Thank you, President Officer. 1 in 3 cancer patients in Scotland don't begin to receive treatment within the government's target time. I'm going to repeat that for the First Minister's benefit. 1 in 3 cancer patients are not receiving treatment when they need it. And in one health board, NHS borders, fewer than half begin treatment within the 62-day target. For NHS Grampian, it's almost as bad. And behind these new and bleak statistics are real people. For them and their families, the SNP's culture of failure can be the difference between life and death. Does John Swinney accept that this is unacceptable? And what will he do to meet cancer treatment times?
First Minister.
President Officer, before I answer Mr Findlay's question, could I acknowledge the announcement that you made at the weekend, Presiding Officer, of your intention not to seek re-election to Parliament at the next election, express my appreciation to your leadership in Parliament as Presiding Officer. In relation to the issue on cancer waiting times, Mr Findlay raises a serious and important issue, and I want to begin by expressing my regret that the cancer waiting times are in all circumstances not being achieved around the country. The 31-day target, which is the target for once an assessment has been made that treatment is required, that target of 95% is very closely met. It's 94.1%, but the 62-day target is the performance is not acceptable. And what the government is doing is focusing on improving the activities and the investment that is made in individual boards to ensure that performance can be improved. We are able to demonstrate, as the data does show, that in parts of the country the target has been met. It's been met in Lanarkshire, and the model of care in Lanarkshire of achieving both the 62-day and the 31-day target is meeting the standard. And what we are ensuring is that the learning from NHS Lanarkshire is being applied in other boards around the country to ensure that the performance is achieved. That is the approach the government is taking to ensure that the needs of patients are met and that we can move at the earliest possible opportunity to address any concerns about cancer within the population.
Russell Findlay.
I also echo the First Minister's sentiments and thank you for your service. He seems content that 1 in 14 health boards this target has been met. It's simply not good enough. The SNP government's flagship NHS recovery plan of 2021 is failing patients just as we warned that it would. Promises to reduce cancer treatment times keep being broken. Yet John Swinney will never criticise Humza Yousaf and Nicola Sturgeon's plan. At least his Public Health Minister has come clean about the price of SNP failure. Asked if lives are being lost because of late cancer diagnosis, she said, yes, they may well be. She said this in the same week that it was reported that the SNP are sitting on a £550 million underspend from last year. That's more than £500 million unspent. So will John Swinney increase cancer spending and use some of that unspent money to launch an emergency cancer fund?
First Minister.
Presiding Officer, within the statistics, I think 2 important observations have to be made in addition to what I've already said to Mr Findlay. First of all, we are treating more patients with cancer on time within both standards compared to the same quarter 6 years ago, pre-pandemic, on both the 31-day standard and the 62-day standard. So our services are treating and interacting with more people than they were pre-COVID, which is a demonstration of the increases in capacity that we have in place. The second point to make is that in relation to the 31-day target, the median wait, that is the point at which, the midpoint in which more people are being treated, or the point at which people are being treated, is 3 days. 3 days. And last year, that point was 4 days. So we are finding improvements in the time in which treatment is being delivered. So I hope that gives Mr Findlay some confidence that the focus on improving capacity within the National Health Service to deal with cancer is at the heart of the Government's plans. Now, Mr Findlay referred to the underspend in the budget. Now, the underspend, of course, is applied to the financial provisions of this financial year. So I want to reassure members of the public that all of the underspend from the previous financial year will be able to be deployed in supporting public services, which of course assists us in supporting the budget that we have in place, which has already increased funding for cancer services in Scotland as part of the National Health Service budget, which of course is the highest budget that has ever been deployed for the National Health Service in the history of the NHS. And the Government attached the priority to this important investment in putting forward the budget that has seen a record financial settlement in place for the National Health Service.
Russell Findlay.
John Swinney seems to be patting himself on the back, which will be absolutely no consolation to all those people waiting for treatment. Because since John Swinney became First Minister, over 3,000 cancer patients are waiting longer for treatment than his government promised. Every passing day puts more lives at risk, but this government is complacent. There's no sense of urgency. The Health Secretary, who's not here today, wasn't even in Scotland to respond to these latest shocking figures. He was on a second trip to Japan, and I've no idea why he's not here today. It's absolutely ridiculous. The SNP press release said that his Japan visit was to talk up Scotland's health technology sector, and I'm all for promoting Scottish technical innovation. But this analogue SNP government can't even deliver a basic app for Scottish NHS patients. So can John Swinney tell worried cancer patients and their families how they will be helped by a Health Secretary collecting more air miles?
First Minister.
President Officer, the Health Secretary is in Japan at the Osaka Expo, which is a partnership between the Scottish Government and the United Kingdom Government, which on 3 occasions this year Scotland has an opportunity to highlight some of the strengths within the Scottish economy. One of those strengths which the Health Secretary is promoting is the life sciences sector, which is a huge asset to Scotland, and the Health Secretary is in Japan at my request, with my approval, to ensure that Scotland's life sciences sector is able to be promoted to an international audience, given the significance of the life sciences sector to our university and research community in Scotland. Now, what I want to make clear to Mr Findlay is that the Government has put in place the investment provided for in the budget, which Mr Findlay didn't support, to ensure that we are able to support the delivery of healthcare services in Scotland with record funding available. We are concentrating. Mr Findlay asked me what steps could be taken to reassure patients. What I would say to patients is that the learning that has been developed in NHS Lanarkshire about improvements in the delivery of cancer services are being shared around the country. The rapid cancer diagnostic services, which are also in place in a variety of other health boards in the country, have seen significant reductions in waiting times as a consequence in different parts of the country, and all of these measures will be deployed to ensure that cancer care is delivered where people need it within our country.
Russell Findlay.
It's perhaps not surprising that Neil Gray was out of the country talking tech, because the previous SNP Health Secretary quit because of his own overseas tech difficulties. But where is Neil Gray's focus? There's a cancer care crisis, but he took taxpayer-funded limos to the pub and the football, and then he decided to go to Japan. And it says everything that John Swinney's happy to admit he sent him there. This is more than a couple of bad calls. It's a fundamental issue about his focus and professional judgment. If Neil Gray really thinks his time is better spent in Japan than in Scotland during an NHS crisis, then he shouldn't be Health Secretary. What has the Health Secretary done to give John Swinney any confidence that he can bring down cancer waiting times?
First Minister.
Mr Findlay started his questions raising very serious issues about the delivery of cancer care in Scotland, and I am determined to engage on those issues because those are issues that I recognise to be of genuine concern to members of the public. I want to assure Parliament that the focus of the First Minister, the Health Secretary and the Government is on improving waiting times. That's what we were elected to deliver, and that's what we are taking the steps to ensure is the case. It's why we put the investment in place which Mr Findlay didn't support. It's why we have the focused discussions with health boards about improving performance, about learning the lessons from areas of the country that are performing well so that we can improve standards in other parts of the country. This government is absolutely focused on reducing waiting times for cancer and other conditions, and that will remain the focus of my government.